Cirrhosis is a late-stage liver disease characterized by the gradual replacement of healthy liver tissue with scar tissue fibrosis, which impairs the liver's ability to function. This scarring is irreversible and typically results from long-term liver damage due to various causes, including chronic alcohol use, viral infections, and metabolic disorders. As the liver becomes increasingly scarred, its ability to perform essential functions such as detoxifying the blood, producing proteins, and aiding in digestion deteriorates. Advanced cirrhosis can lead to life-threatening complications. Causes of cirrhosis: several factors and conditions can cause chronic liver damage, eventually leading to cirrhosis. Chronic alcohol abuse. Excessive alcohol consumption over many years is a major cause of cirrhosis. Alcohol damages liver cells, leading to inflammation and scarring. Chronic viral hepatitis. Hepatitis C, one of the most common causes of cirrhosis worldwide. The virus causes long-term inflammation, leading to liver damage. Hepatitis B. Chronic infection with hepatitis B can also lead to liver scarring and cirrhosis. Non-alcoholic fatty liver disease (NAFLD). Fat buildup in the liver, steatosis unrelated to alcohol use, can progress to cirrhosis, especially in people with obesity, diabetes, and metabolic syndrome. Non-alcoholic steatohepatitis (NASH), a more severe form of NAFLD where fat accumulation is accompanied by inflammation and damage, increasing the risk of cirrhosis. Autoimmune hepatitis, the condition where the immune system attacks the liver, causing inflammation and eventual scarring. Primary biliary cholangitis (PBC), a chronic disease that damages the bile ducts in the liver, leading to cirrhosis. Primary sclerosing cholangitis (PSC), a condition characterized by inflammation and scarring of the bile ducts inside and outside the liver. Genetic disorders. Conditions like hemochromatosis, iron overload, Wilson's disease, copper accumulation, and alpha-1 antitrypsin deficiency can lead to cirrhosis. Bile duct blockages. Prolonged obstruction of the bile ducts can cause bile to build up in the liver, leading to damage and scarring. Drug-induced liver damage. Long-term use of certain medications or exposure to toxins can cause liver damage and cirrhosis. Symptoms of cirrhosis in the early stages. Cirrhosis may not cause noticeable symptoms. As the disease progresses and liver function declines, symptoms may appear, including fatigue and weakness, feeling constantly tired and weak, loss of appetite, reduced appetite, sometimes leading to significant weight loss. Nausea, persistent feelings of nausea or an upset stomach. Jaundice, yellowing of the skin and eyes, due to the buildup of bilirubin, a byproduct of red blood cell breakdown in the bloodstream. Itchy skin, chronic itching due to bile salts building up under the skin. Swelling, edema, fluid retention, especially in the legs and ankles. Ascites, accumulation of fluid in the abdomen, causing swelling and discomfort. Spider angiomas, small, spider-like blood vessels visible under the skin. Easy bruising and bleeding. A decrease in the production of clotting factors can lead to frequent bruising and bleeding. Dark urine and pale stools. Changes in the color of urine, darker, and stools lighter or pale. confusion and cognitive changes. Hepatic encephalopathy. Toxins can build up in the bloodstream when the liver cannot properly detoxify, leading to confusion, memory loss, personality changes, and even coma in severe cases. Complications of cirrhosis. As cirrhosis progresses, it can lead to serious and potentially life-threatening complications. Portal hypertension, increased pressure in the portal vein which carries blood to the liver due to scarring, leading to swollen blood vessels. Varices in the esophagus and stomach. This can cause severe bleeding. Variceal bleeding. Swollen veins. Varices in the esophagus or stomach can rupture and bleed, which is a medical emergency. Ascites. Fluid buildup in the abdominal cavity, leading to infection or kidney dysfunction. Hepatic encephalopathy. Toxin buildup in the brain, causing confusion, difficulty concentrating, and, in severe cases, coma. Liver cancer. Hepatocellular carcinoma. Cirrhosis increases the risk of developing liver cancer. Splenomegaly. Enlargement of the spleen due to portal hypertension, leading to the destruction of blood cells, causing anemia, low platelet counts, and increased bleeding risk. Kidney failure, known as hepatorenal syndrome. This is a complication of advanced cirrhosis. Infections. People with cirrhosis are more prone to bacterial infections, such as spontaneous bacterial peritonitis, infection of the fluid in the abdomen. Diagnosis. Diagnosing cirrhosis typically involves a combination of medical history, physical examination, and various tests. Blood tests. These assess liver function and look for signs of liver damage. Liver enzyme tests. Elevated liver enzymes AST indicate liver cell damage. Bilirubin levels. High bilirubin levels cause jaundice and indicate liver dysfunction. Albumin and clotting factor tests. Low levels of albumin and clotting factors point to poor liver function. Complete blood count CBC to detect anemia, low platelets, and infection. Imaging studies. Ultrasound, to assess the liver's size and structure, and detect ascites or tumors. CT scan or MRI, provide more detailed images of the liver and surrounding organs. FibroScan, a specialized ultrasound that measures liver stiffness to assess the extent of fibrosis scarring. Liver biopsy. A small sample of liver tissue is examined under a microscope to confirm the diagnosis and assess the extent of liver damage. Endoscopy, to check for varices in the esophagus or stomach. Treatment. There is no cure for cirrhosis, but treatment focuses on slowing the progression of the disease, managing symptoms, and preventing complications. Lifestyle changes. Avoiding alcohol, essential for anyone with cirrhosis, regardless of the cause, to prevent further liver damage. Healthy diet. Eating a balanced diet rich in fruits, vegetables, and lean protein, while avoiding salt to reduce fluid retention and limiting fat intake. Weight management. In cases of NAFLD or NASH, losing weight can help slow liver damage. Medications. Diuretics, to reduce fluid retention and swelling caused by ascites. Beta blockers, to lower portal hypertension and prevent variceal bleeding. Lactulose or rifaximin, to reduce the buildup of toxins and treat hepatic encephalopathy. Antiviral drugs, for hepatitis B or C, to control the infection and prevent further liver damage. Vitamin supplements to correct deficiencies, e.g., vitamin D, K caused by malnutrition or malabsorption. Management of complications. Variceal banding or sclerotherapy. Procedures to control bleeding from varices. Paracentesis. To drain fluid from the abdomen in severe ascites. Antibiotics. To treat infections like spontaneous bacterial peritonitis. Liver transplantation. For individuals with advanced cirrhosis or liver failure, a liver transplant may be the only viable treatment. Candidates for liver transplant are thoroughly evaluated based on overall health and severity of liver disease. Prognosis. The prognosis for cirrhosis depends on the underlying cause, the extent of liver damage, and the presence of complications. Early diagnosis and management can slow the progression of the disease and prevent or reduce complications. Advanced cirrhosis with complications like portal hypertension, ascites, or liver cancer significantly worsens the prognosis. When to seek medical attention: unexplained abdominal pain or swelling, yellowing of the skin or eyes, jaundice, vomiting blood or black, tarry stool, signs of variceal bleeding, confusion or difficulty concentrating, sudden weight gain or swelling in the abdomen or legs. Cirrhosis is a serious and progressive liver disease, but with early detection, appropriate management, and lifestyle changes, it is possible to manage symptoms and slow the progression of the condition. For advanced cirrhosis, a liver transplant may be necessary to prolong life.